Intracoronal or non-vital or walking bleach should be considered as a first option for the treatment of discolored endodontically treated tooth rather than veneers or crown, as it is most conservative and minimally invasive method. Let's discuss the points to be considered while doing intracoronal bleaching. Prior to bleaching, assess the radiograph for the periapical status and the quality of obturation. If there are any signs of failed endodontic treatment or questionable obturation, retreatment is mandatory, as good quality 3D obturation prevents leakage of bleached material. Next, evaluate the shade of the tooth at the beginning, as it acts as a point of reference for future comparisons. The tooth should be isolated to prevent leakage of material to the gingival tissues. Remove all the restorative material from the access cavity, refine the access, and make sure that the pulp horns and other areas containing pulp tissues are clean. Remove gutta percha 2 to 3 mm below CEJ or the labial gingival margin, and place 2 to 3 mm of protective barrier like GIC or IRM. And the protective barrier and the 3D obturation are very crucial factor, as if any leakage of bleach material happens, it leads to root resorption. Now, prepare your walking bleach paste by mixing sodium perborate tetrahydrate in inert liquid like saline or distilled water to a thick consistency of wet sand. Pack the paste into the pulp chamber and remove the excess liquid by tapping with a cotton pellet, and apply thick, well-sealed temporary filling material, preferably IRM, and it should be at least 3 mm thick. And it's very important, as there are higher chance of dislodgement of the filling while bleaching occurs. And recall the patient weekly. Repeat until the desired shade or one shade brighter occurs, as there are chances of slight relapse. And just finish the restorative part, and the composite restoration has to be done only 1 week after the bleaching occurs, because it affects the bond strength of the composite. Till then you can place IRM or GIC, and if there are no color change after 3 sessions, reassess the case for the correct diagnosis and an alternative treatment plan.